Ready? Good afternoon and welcome to our Arts and WorkSafe Tasmania COVID-safe workplace plan session. For those of you I haven't met, my name's Jackie Allen and I'm one of the Deputy Secretaries at State Growth. I look after the Cultural and Tourism Development Division, which means Arts Tasmania, Screen Tasmania, Events Tasmania, Tourism and Hospitality Support and the Tasmanian Museum and Art Gallery. I'd like to start by acknowledging and paying respect to the traditional and original owners of this land, to pay respect to those who've passed before us and to acknowledge today's Tasmanian Aboriginal community who are custodians of this land. We're currently going through a pretty unprecedented time with far-reaching impacts and to be fair, we probably don't really know how far those impacts are going to go or how long this situation is going to last. But we do recognise that for those people working in our cultural and creative sectors, it's important to start talking about how we can return to work and provide you with information around the COVID-safe work plan process. So the idea that we have around the session today is that we have Robin Pearce with us, who's the Director of WorkSafe Tasmania, and she will be giving us a short presentation on the regulation environment and the COVID-safe workplace plans. And then we have an opportunity to receive questions from you as participants. We'd ask you to use the chat function on Teams, and we'll work through those questions with Robin later. So the session is being broadcast live. We've been pretty fortunate in terms of technical hitches for the previous 3 sessions we've run today, but please be patient with us if there's a little bit of a lag or we experience a glitch or two. But we're also recording the session and it will be made available on our website for people who aren't able to attend today or who would like to come back and see it all over again. If we can't answer your questions today, if we run out of time or we literally can't answer them because we have to go and get some more information, we are preparing an advisory document which will be available through the State Growth website, and you'll be able to pick up those questions there. And before we kick off for Robin, it's probably important to note that each business or undertaking is unique, and what we're doing today is we're providing you with some guidance around how you can look at your business operations and adjust them for your business. It's not necessarily a cookie cutter experience, and that's why the questions you ask us today will be helpful, because some of them might make us think about things we haven't already thought of yet. So that will be interesting. Now, before we kick off in Robin's presentation, I did want to start with a question that's come up in some of our earlier sessions, Robin. We have some participants who are from volunteer or not-for-profit organisations rather than commercial businesses. Are they still required to do a COVID-safe plan?
The public health direction for the COVID-safe plans applies to all businesses. So regardless of whether or not it's a not-for-profit, it's purely volunteer, or it is a fee-for-service paid business, then you're still required to do a plan.
And there's a particular piece of WHS terminology that might be foreign to some of our participants, which is the Pcbu. Are you able just to define that for us before we kick off?
So the Pcbu under the Work Health and Safety legislation means the person conducting a business or an undertaking. So what that means is that it's it can be either a business or it could be in the not-for-profit space as well. It's the person or organisation that is responsible for carrying out the work and having work carried out. So in work health and safety terms, a volunteer organisation that doesn't employ anybody is not a Pcbu, but they're still covered by the public health direction and required to have a COVID safety plan in place.
Okay, thanks. Over to you now with your presentation, Robin.
Thanks a lot, Jackie. And look, it's great to be here with everybody today and really appreciate the opportunity to meet with you and to walk you through how your workplace COVID safety can operate. would really like to acknowledge all of the great work that so many industries have been doing within Tasmania to put in place safe practices to keep their workplace and community safe. It hasn't been easy, and there's been a lot of effort gone into it, and that's showing in the results that we're seeing when we're out and about in business, that most places are complying or trying very hard to comply. So what I'd like to do is I'll share my screen with you, and I'll walk you through where and how you can find information and prepare your documentation to be able to comply with the public health direction. And that's probably the place for us to start, is all of the requirements for COVID safe workplaces start with the public health direction. And you can find that information on the government's coronavirus tas.gov.au website. And if you look for it under coronavirus facts, there's a link here to resources. And it's quite a useful page because it will take you through where you can find all different sorts of fact sheets. It's got information, and there's some really good posters as well that you might find useful to use in your workplace. And finally, it's got all of the directions that have been issued under the Public Health Act. And there's two that we will touch on. The first is the management of premises, and that is a direction which actually sets the requirements for how many people can be in a premise. What that does is to say, in the first instance, how many people can be in a residential premise, and that is 20 plus the householders, and then it goes on to describe how many people can be in a where there is a business being operated out of a premise or any other sort of undertaking. And it does that by talking about what the maximum density is, and the maximum density is defined in this particular direction, and this is where we get the requirement for the 1 person per 2 metres squared, as well as setting the maximum limits in an undivided space as being 500, and the maximum in an undivided indoor space is 250 people. And it's important to pay attention to that undivided space, because it does make a difference if you have got completely separated rooms. So the direction also covers off on the requirement where practicable to have a distance of not less than 1.5 metres. So that's where we talk about the physical distancing and the separation. And wherever practicable too, to make sure that we're separating people when entering, exiting premises and when they're in foyers and lobbies. And it's putting the responsibility very directly back onto the person who is actually owning or operating that premise to make sure that arrangements are in place for those to be able to be complied with. It's in this direction as well that the requirements are also set for when food is going to be consumed, and that's in a schedule, or when alcohol is going to be consumed as well. And that's where the requirements for people to be seated to consume alcohol and for the provision of food come into play. So that's the first public health direction. The second one, and where most of the COVID workplace information comes from, is this one here called the Workplace COVID Plan, and that came into effect from the 15th of June. Now, when we look at the plan and what the requirements are, we've really got to bring it back to what is it that we know we need to do in order to keep ourselves safe from COVID-19. And that is that it will always come down to physical distancing and separation. It comes down to cleaning and hygiene. It comes down to being able to make sure that people who aren't well are not coming into the workplace, and then being able to track who we may have had contact with in order to make sure that if there is any spread of the disease, we're able to follow up where that may have occurred. So the Workplace COVID Plan direction goes directly to those issues. It reinforces the fact that you've got to have the 1.5 metre separation between people where practicable, acknowledging that that's not always going to be possible. So if it is going to be a situation where it can't isn't possible to separate people, then we need to make sure that the contact is as brief as possible, that people are in close proximity, and as much as possible that it's not face-to-face, and that people are covering any coughs, sneezes, and reducing any opportunity for the spread of droplets. The direction, this direction was issued prior to the premises direction, so it does still talk about the density maximum as being 1 person per 4 metres squared. That's now been superseded, though, of course, by the premises direction, which has extended out to being 1 person per 2 metres squared. The direction does make a requirement for the business to stay up to date on what is actually going on in the area of COVID-19 as it might affect their particular type of business. So, you know, what is it that's happening out in the arts sector that you should know about, that you can apply to keep your business safe, as well as staying in touch with information from, for example, public health, what's on the coronavirus tas.gov.au website, or even Safe Work Australia, where there's some great ideas and suggestions for how to keep people safe. It sets the requirement for there to be cleaning where appropriate, so cleaning, and if appropriate, disinfecting. So we need to remember that it's not always necessary to disinfect. In a lot of cases with COVID, simple, straightforward cleaning using detergent is sufficient. Disinfection really mainly comes in where we've got an exposure that's actually occurred within the workplace. Hygiene measures is a critical factor, and having the opportunity for people to take hygiene matters, but also take hygiene precautions, but also communicating to people what the expectation is for them to maintain appropriate hygiene. Making sure that they've got the supplies and the equipment to be able to clean and to be able to maintain hygiene is critical, and so that is specified as something that a business has to do, or a workplace has to do. And it's really important to make sure that workers are informed, trained, instructed on what they have to do, what are the expectations of them, and how are they expected to interact within the clients within the workplace. Where there are people coming onto the workplace who are not workers, it's important here to also remember that they also have to be provided with information, and that information is to be reasonable as to informing them on what's expected. Now, that can be signage, it can be verbal, as long as it is actually going to be done systematically, and you can be confident that every person that comes into the workplace is going to be able to get that information. There's a requirement around entry into the workplace and making sure that the workplace is ensuring that people who are unwell or just showing symptoms of the disease are not entering the workplace. And finally, if you already keep a record of the people who come onto the workplace, then you have to maintain that record for 21 days. Now, obviously, it's ideal if we can actually capture all of the details of people who are coming onto the workplace, but importantly, if it's already a practice, then you've got to keep those records for 21 days. Now, underpinning all of this is the concept that there's a need to manage the risks. So that's all of our work health and safety legislation is based around the concept of minimising risk, eliminating the risk wherever possible. Now, in a lot of cases, that's not going to be possible because people are going to be coming together. So how do we go about mitigating it? And where we do put processes in place for that, the key is to then record that in writing. And that is where your COVID safety plan comes into play. It's one of the really simple ways for you to record in writing what you are doing in order to keep your workplace safe. So where can you find that information? If you go to the WorkSafe Tasmania website and click right up on top on there's a link to our coronavirus information. On this page, we have information for industry, and that's our landing page where you'll then be able to find the information around our COVID Safe Workplaces framework, as well as the industry guidelines. Under the framework page, we narrow then in to looking at our COVID safety plans, the templates and the checklists, and there's also a link to our COVID safe workplace guidelines. So what we have done in conjunction with our agencies who work with industry and with industry stakeholders is we've developed over 60 industry sector guidelines that are there to be able to help and inform industry on some of the things that can be undertaken to help them put in place a COVID safety plan and put good processes and procedures in place to suit the particular industry. So you'll see that there is one here for cultural and creative industry sector, and that works you through what are some of the things that it's useful to do in order to prepare your COVID safety plans. And it takes you through each of the different sections that you'll see when we walk through what the COVID safety plan looks like. So a really useful place to go to get ideas and information. And there's also information available on Safe Work Australia's website. So if I take you to our COVID safety plans, essentially we've got 3 different approaches in terms of plan templates. The first is that we've developed a template for small business. We've then got one for medium business. For large business, look, we'll largely leave that up to the very large businesses to determine the most appropriate approach that they want to take, because they are more complex in terms of the arrangements that they need to put into place. Whether you want to pitch yourself as a small or a medium-sized business, that's really your call. Have a look at both templates, see which is best going to suit the nature of your business and what you want to look at using. We don't dictate which template you use. You can use these templates, you can use another template. For example, we've got a link here to one that's been developed by the National COVID Coordination Commission, because that's another good example of a template that could be useful. So if I show you initially our small business template, what that does is to take you through some very simple information in the first instance about the business. Importantly, what the business name is, the date on which you prepared your plan, and really importantly is whether or not you've consulted with your workers and health and safety representatives in consultation in the development of the plan, because that is an obligation under the work health and safety legislation, that you do need to consult and communicate with your workers and health and safety representatives when developing the plan. The other point that's really important is making sure that the plan is being reviewed and updated. The environment is changing all of the time. The level of risk is changing all of the time in terms of COVID, and that means that we do need to go back and be reviewing the measures that have been put in place to see whether or not they are still appropriate. So the plan's set up following essentially the standards that are set under the Public Health Direction, starting off with managing the risks of COVID-19 and getting you to think through some of the things that you might need to do in order to manage the risks. And in thinking through that, it's a matter of thinking about what is it that you do in your business that could expose people to droplet spread. And it's as simple as that when it comes down to it. Yes, there's some minimum things that you must do, but it's all about controlling the spread of droplets from one person to another. We get you to walk through some of the straightforward things, which is about, knowing what the current legal requirements are, identifying what workers are actually at risk of exposure. Do you have any vulnerable workers that are coming into your workplace? People who may be immunosuppressed or have some other sort of condition. People who are older are particularly vulnerable. So you might need to think particularly about what steps you need to put into place to reduce the risk to them. And considering things such as, for example, when you get into filling out the template, some of the very simple ways in which you can stop people who might be unwell coming into the workplace. What messages are you sending as an organisation to try to limit them coming in and making clear that you don't want people who are unwell attending work? Thinking about, are there any other ways in which COVID-19 could enter the workplace? For example, through people who might be coming to the door to deliver goods that you may need to consider. When they're actually entering and leaving the premises, how do you actually manage the flow of people to reduce the spread? It asks you to document what strategies you've put in place, and then actually document how you went about consulting with your workers and with health and safety representatives on the ways in which they can actually help to control the spread and the things that you expect them to do when they're at work. The second standard we go to then is cleaning and hygiene, and that makes it clear that as a business or as an undertaking, you need to make sure that you're preparing and implementing a schedule for cleaning, and where appropriate, making sure that there's disinfecting that's taking place if that's actually necessary. You do need to have a cleaning schedule in writing so that everybody knows what's actually going on, and have that so that it sets out how frequently cleaning's taking place and how the cleaning is actually occurring. And what that does is to help to give confidence to your workers and to your patrons who are coming onto the premises to know that cleaning is occurring and that they can have some level of comfort that droplet spread's being reduced. It asks you to identify the hygiene procedures that you're putting in place, making sure that you've got sanitizer that is available, the expectation that there are going to be facilities available for people to wash their hands, and the expectation on how they should go about washing their hands as well. So after giving you a bit of an introduction into that, it asks you to actually briefly outline what your cleaning schedule is, and also what you've put in place to clean those frequently touched areas and surfaces. So those are things such as your FPOS machines, your doorknobs, handrails, any area where you look at it in the nature of your undertaking, you can look at that and say, well, look, that's something that I can see that people are going to be touching frequently, so therefore we need to actually have in place some more regular cleaning than what you would do for those surfaces that are not touched quite as frequently. If your undertaking is involved in using vehicles, then thinking about how you're going to go about making sure that the vehicles can be cleaned regularly, particularly if it is moving from person to person to person. So that's something when it comes to cleaning that's really important to think about. The risk is much lower if one person is the only person who is using a particular piece of equipment. But if that piece of equipment is going to pass from one person to another, as it might do if you're talking about props in a theatre show, you need to then think about how you're actually going to be able to make sure that that is cleaned regularly and the risk of transmission is really reduced. Hygiene practices, we asked you to actually outline what the steps are to maintain appropriate hygiene and who's supposed to undertake them. So those might be things such as, you know, your staff are expected to use sanitizer when they enter and exit the building, or after they touch certain pieces of equipment if they could have been used by a number of different people. What your expectations are around when people are going to clean and wash their hands, and whether or not you're confident the workers know that they actually understand those requirements and they'll be able to apply them. It walks you through identifying the supplies and equipment that you're going to need, and whether or not you've got them, what they are. And it's all about being able to help work you through whether you've thought of each of the key elements in maintaining the appropriate hygiene and cleaning requirements. We then move on to restricting entry into the workplace, whether or not you've displayed signs at all of the entry to your premises, and that can include a requirement that no one enters the workplace if they've been instructed to stay in isolation or quarantine. Now, we have had some workplaces that have said to us, well, look, we don't want these signs everywhere. is there any way that we can, not have the signs? And there are some who have got some really clear, rigid arrangements in place where every person who walks through the door gets given exactly the same information about what the requirements are and the expectations are. If you are able to ensure that that happens, then that may well be an appropriate measure. If you've got so many people coming through the door that you cannot make sure that you've restricted entry to all of those people who might be at risk, then signage may well be a better approach for you to take. This section goes through working you through about contact tracing, how are you actually able to trace people who have been into your workplace, and if you've got that documentation, then making sure that you're able to keep that to the last 21 days, for the next 21 days, I should say. And finally, we get into the physical distancing requirements at the workplace. Now, this is where you need to know what is the amount of space that you've got and how are you actually going to be able to manage that space. You need to know what the capacity is of your premises and what the capacity is of your undivided spaces, and make sure that you know what is it that's a rule that applies at the time, because as we know, that has changed to the 1 person per 2 metres squared. Should the risk escalate, there's always the possibility that that could change back up to the 4 metres squared requirement. So once you know what your capacity is, thinking about how are you going to get people to distance and keep their separation to 1.5 metres between people as much as possible. Now, where you've got a lot of people coming together, think about separating people by means of those who are in the same household, because they've shared already a level of risk, and keeping people who are in different households 1.5 metres apart. That's a far more practical and pragmatic way than looking at it and saying every single individual has to be 1.5 metres apart when they may already be living in the same premises, and the level of risk is much lower between that particular group. Now, if you can't maintain 1.5 metres separation between people, it's thinking about what other controls are you going to put into place to reduce the risk. And that might be making sure that there could be fewer people in the workplace. It could be making sure that they are cleaning more regularly, arranging seating so that people aren't sitting face to face. So there are some other things that we can do to reduce the risk in that space. The standard around providing instruction, training and supervision in relation to COVID-19. And this is, again, walking you through some of the ideas of the sorts of things that you can do to inform people in the workplace of the expectation and the requirements, and ask you then to outline the approach that you're taking. And then whether or not you've actually documented your overall procedures as well. When it comes to responding to an incident of COVID-19 in the workplace, the reality is that in the vast majority of cases, it'll be public health who will be letting you know that there may well have been a contact in your workplace, and they will give you the direction on what steps need to be taken should that actually occur. And then finally, outline what your process is for reviewing and adjusting the controls. If you work your way through those steps, filling out the boxes, sign it off, complete it, and then review it on a regular basis, make sure, importantly though, that you've actually implement all of those things that you've said that you're going to do in your plan, because it's the implementation of it which is the most important part. As I mentioned before, there's also a medium template, and that medium template covers essentially the same things, but it gives you greater flexibility to think about a slightly more complex organisation, and asks you to think through what are the things that you need to do, how you will do each of them, when are you going to do them, and what supplies you might need. And so it lets you work through the process so that you're able to develop it particular to the needs of the business you run. And that might be particularly important if your business is a mix. You might have some retail aspects to it as well as the performance aspects. So, Jackie, we might at that leave it for people to ask any questions.
Fantastic, Robin. The questions have been coming thick and fast, but I might start with a fairly basic one, and that is, do you have to use the WorkSafe Tasmania template when you're doing your plan?
No, you do not. Okay, the public health requirement requires you to document what you have put in place. How you go about documenting that is absolutely the core of the undertaking, but you do need to document what you are doing around cleaning, hygiene, physical distancing, keeping people unwell, all of those features that are in the public health direction. You've got to have it documented.
Fantastic. So we've had a couple of questions around the interaction between venues and performance companies that might be using the venue. So one of those questions is, you would assume that both the company and the venue have their own COVID safe plans. What is the process for bringing those two things together?
Okay. So in work health and safety language, we talk about this as being shared duties, and there's a requirement for organisations to collaborate on what they're doing. So what that means is that everybody has got a duty to make sure that they look after the health and safety of the people that are within their organisations. They need to develop their plans. The theatre company that has the premises needs to make sure they have arrangements in place for how they are going to keep it COVID safe, and they need to identify in that what their expectations are of the company that's coming in to do the performance. They then need to sit down and talk. So the company with the performance has got its guidelines about what the expectations are. They need to very early on talk about how are they actually going to meet each other's requirements and come to an agreement on how they will be able to demonstrate to each other that they are applying the requirements, and then communicate that back to the performers.
Thanks. We've had a really specific question around performers. So in theatre and dance, performers are often in contact with each other, particularly with dance where there might be close contacts, lifts, things like that. Do you have any advice around how situations like that could be managed, and how this is being dealt with in the sports field?
Yeah, so in the sports space, and there's some really good, if you want to have a look at the Australian Sports Commission has got some sports guidelines in place that's worthwhile looking at, and they have different stages for what the level of distancing and contact can be. So at a point where the level of harm is pretty low, and that's really the space that we're getting into right now, having some incidental contact is going to be okay. But what you want to be doing is making very sure that the people who are performing are well. That's your first control, is that no person who has got any symptoms should be able to perform. Then once you've done that, it's a question of making sure that you've got good cleaning and hygiene, so that the performers know very much what the hygiene expectations are, their requirements to cover, to dispose of any tissues, keeping good hand sanitation, and where possible staying out of each other's breathing zones, if that is possible to do. Keeping contact, short duration, limiting it being face-to-face, and then maintaining cleaning and hygiene.
Thanks. A very topical question is to do with the maximum number of people you can fit in a building. So as I understand it, the maximum number for a gathering is currently 250 people. We were talking earlier, though, about how that is in specific spaces within a venue. So, for example, the back of house might be counted separately to the foyer space, might be counted separately to the auditorium. Is that accurate?
So the public health direction talks about the number of people in an undivided space. So if that space is, so there can be 250 people in any undivided space. That's how I understand that it works, and I believe that that undivided space, you know, as soon as you start separating that up, then that could change the way in which those numbers fit. And I'm just thinking through that as we're talking, Jackie. So 250 is the maximum, and once you divide that, then that's creating a new space. I think it's one of those ones where, to make it really clear, we would need to get some further advice from the Director of Public Health.
Thanks, Robin, and we'll certainly look to do that through the expanded advisory document that we're working on at the moment. We've had a question about plans. Is there a requirement to lodge them anywhere or have them approved? What do you need to do with your plan?
The plan is yours to develop and yours to apply. It doesn't need to be lodged anywhere. You do need to have your documentation available though, should an inspector come to look at how you're going with implementing the plan, then the inspector will ask to see it, but you don't actually have to lodge it or get it approved.
Thanks. Excuse me. We've also had some questions about outdoor events. Are they treated differently in terms of the size of gatherings? So, for example, if someone was organising an outdoor performance in the botanical gardens, how does that work?
So in the outdoor spaces, the maximum density is